Hey, Dr. Mike Franco here, board certified plastic surgeon and hand surgeon at Cooper University Hospital in South Jersey. We're going to talk a bit about cubital tunnel syndrome. This is similar but different to carpal tunnel syndrome, which a lot of people know as the problem when a nerve gets kinked or squished at the level of your wrist, leading to symptoms in your thumb, index, and long finger mostly. Now, that is called your median nerve, or the nerve that runs sort of the middle of your arm. Now, cubital tunnel syndrome refers to pressure on a nerve at the level of your elbow. And this nerve is called your ulnar nerve. This is a nerve that happens to lie on that spot that we sometimes call the funny bone, the area where we hit it or bang into it, and it sends zinging shocks down our fingers and hurts quite a bit. The ulnar nerve that starts up the neck and travels down the inside of your arm and goes around the elbow is responsible for bringing sensation to the small finger and half of the ring finger. It also is critical to supply the muscles within the hand that allow our hand to do the very intricate motions that we do when we use our hand to pick something up. We use our hand to write. We use it for delicate motions like sewing. The ulnar nerve is critical. Now, this nerve gets squished at the level of the elbow in a tunnel we call the cubital tunnel. Pressure is increased within the cubital tunnel when we flex our elbow greater than 90 degrees or when we're in full extension. It sort of likes to rest, as you might just imagine, lightly flexed at the elbow. In some patients, related to their own biologic factors or related to neck injury or injury somewhere else in their body, end up with pressure on the nerve at their elbow that exceeds what the nerve likes, meaning the nerve is getting kinked. In this case, you could end up with numbness and tingling in the small finger and ring finger, and eventually weakness in the hand. If you leave that go for some time, we can end up with a posture of the hand we sometimes call a claw hand. That's not such a nice way to describe a person's situation, but it means the hand is stuck in a posture that is not really useful in life. Now, that's extreme. Most folks present to me and say, yeah, when I sleep or when I bend my elbow or I'm sitting on the computer, I feel numbness and tingling in these fingers. If you see me in the office with those kinds of symptoms, I'll put you through my examination. We'll look for symptoms that I can elicit with pressure on the nerve and flexing the elbow. We'll tap along the nerve looking for signs of pressure. And very likely, I'll send you to one of my partners in a different specialty to get a nerve test called an EMG. We'll then use that for the next steps of planning. Early steps are start with therapy and nerve glides. Help that nerve be as healthy as it can be. Next, or along with that, is wearing a brace or a pad to protect the nerve itself. It helps prevent overflexion of the elbow or over straightening and keeps the hand or arm in a nice posture with padding on the elbow. If this isn't working for us, we discuss surgery. There are different versions of the surgery, but the goals of the surgery are to take away the kinking or pressure point, which is a band or a ligament of tissue over the nerve, and prevent injury or kinking of the nerve from my surgery. These are critical points. Now, this is hard to say it this way, but it's one of my favorite surgeries. I feel really in tune with it, and I had great training in this surgery. I feel that I understand the main goals are to take away pressure on the nerve and not hurt the nerve or the surrounding nerves while doing this. In some cases, when the nerve is very unhappy in that position, the funny bone position, we have to do a bigger cut and actually move the nerve to a nice soft spot in front of the elbow. Bit of a bigger cut, a bit of a bigger surgery, but overall, we do what's best to protect the nerve. The stitches are usually put in as dissolvable stitches under your skin that just go away on their own. After surgery, you leave with numb area on your arm and a big soft wrap that we allow to sit there for about 2 weeks. And we just baby the arm. After that, we try to get you back to life. Now, there's some other nuances to this when we go into more extreme pressure on the nerve, but for now, we'll leave it at that. This is my basic explanation I give to patients about cubital tunnel syndrome or pressure on the ulnar nerve at the elbow. Now, if you have any of these symptoms, reach out to us. I love chatting about it, and we look forward to meeting in the office. And thanks for letting us take care of you.